Over the last 20 years, a lot of studies conducted in various laboratories around the world have shown that if you take sedentary individuals and you exercise train them, you can induce some loss of body weight, some loss of body fat, you can reduce blood pressure, improve lipid profile, and improve the insulin sensitivity of sedentary individuals. But those studies were conducted in a rather artificial laboratory environment. A very legitimate question to ask is, in clinical practice, in the hospital environment, what can we do to actually have a true impact on the body fatness of sedentary individuals and on their risk factor profiles? Now, we have two large prevention of diabetes studies, the Finnish Prevention of Diabetes Trial and the U.S. Diabetes Prevention Program. Those studies have really provided evidence that indeed among high-risk individuals who were abdominally obese and who had impaired glucose tolerance, so those were really a subpopulation of patients at very high risk of developing type 2 diabetes. If you are able to give those high-risk patients access to a multidisciplinary team, let's say on a monthly basis they have the opportunity to see a dietitian so that the dietitian can interact with the patient and reshape the nutritional habits. And if, again, the team of health professionals can work with those high-risk patients to stimulate them to be more physically active, well, the two prevention of diabetes studies have provided remarkable evidence that you can reduce by just a little bit of body weight loss, 4 or 5 kilos of body weight loss, you can reduce for these patients their risk of developing diabetes by almost 60%. So those are really landmark intervention trials showing that indeed, not in artificial laboratory settings, but in real clinical condition, one can indeed prevent type 2 diabetes, provided that indeed we can give that type of support to high-risk patients.